My name is Dr. Sidney Rabinowitz. I'm a board-certified plastic and reconstructive surgeon, as well as board-certified hand and microsurgeon. Trigger finger is an extremely common condition in America. It affects up to 2 to 3% of people and up to 10% of people who are diabetic. And what it is actually a swelling of the tendon that flexes your fingers. So if I can demonstrate, when you flex your fingers like this, people who have triggers, they have a nodule that develops because of inflammation for most times unclear reasons. And so when they flex their fingers like this, they won't be able to extend. So their finger will get stuck. So the other fingers might extend and this one will pop as it opens. And that is a definition of a trigger finger. Trigger finger is a clinical diagnosis. We don't need any specialized tests for it. It's something we see from the history and clearly on physical examination. And like any other condition, there's a range of symptoms you'll have, from mild to severe. People will come in complaining of some pain, usually in this area of the finger, and others will come in with their fingers just completely locked in position like that. The treatment for trigger finger is much like the treatment for other conditions in hand surgery. We start with least invasive and conservative measures if we can. We can try to do splinting. We can try to have them take anti-inflammatory medication. And if that works, terrific. If it doesn't work, the next most common treatment we do is injection of a steroid into the finger. It's a small amount of steroid. It doesn't impact them in terms of systemically, the rest of their body. And that is about 80 to 85% effective by itself in treating it. So usually trigger finger we can treat non-operatively. However, for those who fail injection therapy, and we usually give them about 2 or 3 rounds of injection therapy to try to succeed, then surgery is the next option. Surgery for trigger finger is appropriate when either it's very severe or they failed non-operative management. The surgery itself is straightforward. It's an outpatient procedure. It could be done under local anesthesia, or it could be done when patients are in twilight sleep. It takes me about half an hour, and we make a very limited incision. And the great thing is that there's no splinting afterwards, there's no therapy required. Patients start moving their fingers the same day. Once we take the stitches out, they're free to do whatever they want with no limitation on lifestyle. On the day of surgery for trigger finger, it's an outpatient procedure. So it's fairly straightforward. They can expect they need to have someone drive them to the hospital if they're receiving some type of anesthesia. But the surgery itself is quick. It's 20 minutes, and then they usually go home about an hour to an hour and a half after the surgical procedure, and they could resume pretty much normal activities that day. Following trigger finger release, whether it be one finger or multiple fingers, the patient will go home that same day. There's no splints on, so the patient can start moving the fingers. I put a very minimal bandage on. They won't be able to get it wet. But typically, we don't need specialized hand therapy for this. The stitches come out usually between 10 and 14 days post-operatively. And we expect a 95% success rate in terms of elimination of this trigger with no need for any additional surgery.